In the morning inaugural session, I would now welcome our next speaker. Narendra Singh is adoption lead of the Ayushman Bharat from National Health Authority. And I'll ask him to speak on enabling public health care with emerging technologies. Over to you, sir.
It's a cool evening, so morning is also good here. So I'll just start talking about ABDM. So this is the, yeah. Before I talk about ABDM, so let me talk about the revolution which has taken place in our country. When I started my career in 2000, so I got an account in one of the multinational banks, and they had an ATM, and they also provided internet banking. So what internet banking at that point of time used to do, you can see your bank statement. Instead of getting a physical bank account or going, getting your passbook updated, you could get a real-time update of your bank account. But it was not adding much value. So some of the banks had ATMs, some of the banks did not have ATMs. So over a period of time, this evolved, and we got ATM cards which you could use across banks. But still, we had to carry cash. If you go to market, you go to any place, if you carried a credit card, okay, some people may take a card, some people still ask you for extra charge when you pay by credit card. But if you have you have carry cash. But now this is all changed. Now we don't carry cash. We don't even, for 1 rupee transaction, we use UPI. It's all cashless. So this is what has changed. And why it has changed is because we have got a bank account which we could open using our Aadhaar identity system. We have a mobile connectivity, and so all this, it's become ubiquitous. You can just go pay money anywhere, anyone. I mean, even the wallet is no longer used anywhere. I've forgotten my wallet at home many times, and I go and I do everything. I mean, I paid cash, I bought metro card tickets, I paid my parking tickets. I've done everything using this thing. So let's talk about health. When we go to a doctor, if you go to a doctor multiple times, if you go to a hospital, you'll see where people are coming to the doctor with chronic diseases, they will be carrying one bag with them. Or some people will be carrying a file. So what happens is they carry all the records, and the doctor sees, and he or she glances through other thing. If you shift hospitals, if you shift cities, in between you're transferring all your things. Sometimes you forget one of the papers get missed, and you lose that thing, lose that paper. It's all lost. The doctor doesn't have history with him or her. So if you go to a government hospital, you'll see people with chronic disease. They're actually not carrying files. They're carrying big what we call jholas in northern India. So then we started using digital records. Some of the hospitals started creating digital records. The doctors started prescribing everything on the computers. One of the advanced hospitals, they don't even give a paper printout of your prescription. They just give you an app, you can access all those things. But that app is limited to that hospital. So still, if you want to go to another hospital, you'll have to take a printout, and you'll have to again go through the whole process again. So what through ABDM we are trying to do is that we are trying to integrate all these systems that the data can be shared. So just as now I can transfer money from one account to anyone else's account or anything using my app, similar kind of thing would happen through ABDM, that even if you have digital systems, you're not able to transfer records. So, but these records will be accessible by a doctor who is in AIMS or who is in PHC in some remote part of the country, or they may be in Apollos and Fortis and Medantas and Kaveris of the world. So all these doctors will have access to these records. The requirement is that these systems are integrated. And when we say that's what we are trying to achieve, as you're talking about standard ICD-11 or all those things. Every hospital keeps records in their own way. But can the other system talk to that record or not? So that's where we are trying to do. We are trying to do through standards ways. The data will be transferred in a standard way. Now money is transferred from one bank to the another. It's a very standard procedure. You have a bank account, you have an IFSC code which identifies the bank, and you have the amount of money. Every bank uses multiple systems, but you're not bothered about it. SBI has another system, ICICI Bank has another system, some Citibank has another system, but the money gets transferred instantly in many cases, or it takes half an hour if you do NEFT. So that's what we're trying to achieve. This will be scalable. When you talk about hospitals in the country or clinics, they are not in thousands, they are in lakhs. The doctors are, one parliament question answered that there are around 30 lakh doctors across various systems of medicines. So if many of them have their own clinics or hospitals or PHCs, you can imagine the amount of data. If we have a population of 100 crore, just imagine if when 1% of those people go to the hospital daily, that's around 1 crore people, and then the amount of data transfer which will happen. So this is the thing that we are trying to achieve. It is scalable. The data is staying where it is. We are not creating a centralized warehouse of data. So in your banking system, as I said, the bank has your account and your amount. RBI doesn't know which I have an account in ICICI and what is the amount. So there's no centralized. So similar kind of thing will happen in medical field. So if I go to Kaveri Hospital and I get some treatment there, my system will be, my data will reside there. If I go to Ramaya next month and the doctor feels the need to access the data, they will be able to get it. So we'll be talking about it in next slides also. But and it's available for all. It's inclusive. It's you get an ABHA account which is based on Aadhaar. You will be able to see it. And how we are achieving all this? See, to achieve all this, we are creating certain registries. It's an identity. In a banking system, an IFSC codes identifies a bank branch. An account number or a customer ID identifies a person. And that's how you can transfer money from one bank to the other. So similar kind of thing needs, when you talk of a digital system, you need identities for various people. So the first identity is for the patient. Every bank has its own, every hospital has its own UHID. If we want to get data, you'll be in a banking system, you send the bank account number. But here we have tried to, now you use through, UPI is based on phone number, so that's all. But phone number is not something which you can use for bank account, health account, because I think everyone in the family will have multiple, we don't have, everyone having a phone number in the family. So what we have created is an ABHA Ayushman Bharat health account number. So if you go to any place, any hospital, they will map your UHID to this ABHA account number. So this ABHA account number can be seeded as a linked number which can be used for transferring your records from one place to, from one hospital system to the other hospital system, labs, or any other system which is there. And it is based on Aadhaar. We are not using Aadhaar for identifying a patient. It has its own requirements. And it's an identity system. This is an health account. So there are two different this thing. So just wanted to tell you that. And so every person will have only one health account number because we are basing it on Aadhaar. Other thing is we got a health professional registry. As I said, someone's, one of the questions are asked, there are 30 lakh doctors in this country. There will be nurses, there will be other other type of paramedical professionals. But we don't know how many are there in this country, exactly where they are. Whether if you go to a small town, there will be, someone would have written, I'm a doctor, they will list all some degrees. They have gone to London, they have gone to all these places, but there's no thing to verify whether it's correct or not. Whether the doctor is actually a doctor. I personally know of cases where people have worked with a doctor as a nurse in some city. When they go to their own village, they start a hospital and they have written doctor, and it's a very, the doctor was, she used to treat childbirth and all those things, and she's also doing the same thing. She is treated as a very good doctor. I tell you because someone told my wife to go and see her. When we are living in Delhi, when we went to Patna, she told that, गाँव में बहुत अच्छी वो doctor आई है, she's very good. So that's the kind of thing we have. So once we have this health professional registry, the doctors and the nurses, all those for every system of medicine, they will be registering there. They'll be verified through the various medical councils, and also their work will be verified. So this this can be used to access by anyone in the who's in the ABDM system. Health facility registry is another identity registry for all the facilities, all the health facilities, maybe a lab, maybe a clinic, maybe a hospital. And the need for this was very much felt during the COVID times. We didn't know which hospital, where it is, what facilities it offers. So the kind of information that we are trying to get here is all voluntary. I mean, the first thing which is mandatory is that the name of the hospital and the location of the facility. That is a mandatory thing which everyone has to give. But the kind of facilities, what time you open, what are the kind of services you offer, or what is the infrastructure that you have, it's up to the hospital to provide. But if they provide, it's a very good source of thing. And people are doing it. I mean, because if you are a good hospital, you are providing more, you have a hospital with more than 500 beds, you would like people to know about it. And the last thing is the gateways. I'll be talking about it in the next slide. It is something which is, all these three identity systems will ultimately lead to certain thing that we are trying to do. First thing, I'll talk with the middle one, which is a health information exchange. When I was talking about that the health information will be transformed from one hospital system or a lab or a clinic system to any other doctor who's asking for it, that's what we call a health information exchange. So when I go to a hospital today, and I have an ABHA account and the system is ABDM enabled, an entry is made somewhere in our system that Narendra Singh went to this hospital this day and a record exists for him here. When I go to hospital number 2 or I go for a lab test, again this is entry is made that some record is existing for them, for Narendra Singh in this lab. Let's say tomorrow if I happen to have some problem, I go to a doctor, he says, have you had any problems in the last 6 months? So I'll say, okay, I have, but I don't, sometimes when I have a problem, I focus mainly on the problem which I have. So I will not be telling him the complete history. I had pain in my leg, so now the pain is in the leg. I give you an example of my friend whose mother had pain in her arm, in her hand for a long time. And the doctor was treating her. They're not able to find a solution to the problem. Then she came to Delhi and the doctor inquired about her, something which happened to then a year. Then the lady told him that she had chikungunya 1 year back and it started from her hand. So the doctor said that that was the main cause because the way it starts and there is some problem had happened, but they are not treating it. So because as a patient, I don't know. As a patient, I don't know what to tell the doctor. And doctors sometimes have time, sometimes they don't have time to ask each and everything. But suppose he just says, okay, I'll check your medical history for last 6 months. So a request he will make from his system, a request just as, when you go to some of these places, they make a request for payment, make a request for 500 rupees, similar kind of thing. He'll make a request for all your records for last 6 months. So at that point of time, I will get a notification on my phone that Dr. X is asking for your, these 6 months records because he's trying to treat you. And then I see these are 10 records which are available. So again, normally I should not apply the judgment, but still some people think that, I don't want to share everything with the doctor still. So out of those 10 records, I'll say, okay, no, I'll share only these 9 records. And when I click on those 9 records, the doctor will get access to at least those 9 records. So it's a consent-driven framework. It's not that the doctor has access to each and everything whenever he or she wants it. I'll come to know about it, I'll approve it, and then only, just as you approve your bank amount of money that gets transferred from your system. That's the kind of consent that we are saying of. So it's a health information exchange and consent manager. And every time I give a consent, it can be for a specific period of time. If a doctor has got access to those records, if I say it will be visible to the doctor only for 5 days, he can see it only for those next 5 days. If the treatment goes for further period of time and the doctor wants access again, then he has to again request her. So that kind of thing is there. And I think the corner more points are things which are in the pipeline. Not exactly in the pipeline. The pilot and POCs are already done for these things.
Just I want to share. Kaveri is one of the very few hospitals joined voluntarily with NHCX. One team from the central government visited our hospital, and our HMS is getting integrated with NHCX. And we volunteered, and it is going to happen. And now, many of the insurance claims, the approval letter and the final authorization letter is shared only in that.
Yes, sir. Actually,
Kaveri,
I was just going to come to that. Health information exchange, we had actually had a workshop sometime back. I'll tell you about it. So first thing, let's talk about UHI. We are all aware of various apps in the market where you do teleconsultation. I don't want to take names, but still, you know. And there are apps which allow you to do book your lab tests, but they are limited to that specific, the number of doctors who are on that platform. It's like this: if you go to Amazon, you can buy products only from the sellers who are on Amazon. If you go to Flipkart, you were able to buy things only from the people who are there on Flipkart. But if you Google, want to buy a mobile phone, it will list you that on Flipkart this is the cost and this is the cost. But again, you can't do a transaction. It's only an information service that you could do. Through UHI, what we are trying to do is that we are integrating all these all these platforms. They all come in through a common protocol. So if I open any app and I want to book a test, and I want to book a test in Bangalore, so I'll search for a lab near me. So I will get all those labs which are listed on 1mg, Practo, Harocare, or any other thing. And I would then, as a normal thing, I would compare prices or availability, open, and all those things, and I'll book a test. So I would be able to book a test. So I am not limited to one single platform. If I feel the need for a teleconsultation, we all get due to acidity, we get pains in our body. We feel it's a heart attack, and it may be sometimes. But we want to consult a doctor at that point of time. So if we are at a place where the doctor, hospital is not nearby, we would like to do a teleconsultation. But if you start searching for a doctor who is available teleconsultation, so if you have 10 apps, so you may be lucky you will find the doctor in the first app, or you have to go to the 10th app. So imagine the kind of frustration and the kind of anxiety that it builds up till you find a doctor. So through UHI, you will not need to do all that. You would be able to search only one doctor through one app, and you will get your result as quickly as possible. So this will be available for teleconsultation is up right now, and it's a pilot phase. Some of the apps which are allowing this, and we are trying to do lab consultation, ambulance booking, and even blood banks searching. So all these services will be available through UHI. So just as you are making payments, anyone who's on GPay or Phone Pay or Paytm, you just make payments through one single app. That kind of thing you will be able to do. Health claims exchange, it is something which, we have been talking about that, India is an underinsured country. But even if people who have insurance, you can imagine the kind of pain if you go to a hospital, the kind of pain you have to go through. Not the pain in terms of, the doctor treating you or maybe, settlement. The first thing is that pain that you have to provide the amount of information to that person who during the pre-auth stage. You go, you just tell that, okay, the patient has to be admitted. They will ask you for insurance policy, identity card, then something else, then they'll go across. So it takes around 3 to 1 hour is the best case. 3 to 4 hours is an average case, and it may go next day also sometimes. So pre-auth is there, then 2 days later, 3 days later, whatever happens, and the doctor, they normally take rounds, I think, in the morning. And they tell everyone around 8 or 9 o'clock, sometimes, when the sun has just risen, 8 o'clock, the doctor will come and tell you, okay, boss, you're fit and fine, you're ready to go, please go home, and you come back to me after 1 week for whatever follow-up, something. But I don't know if the experience that you have had, but once the doctor told us to leave at 8 o'clock in the morning, the sun had just risen, and when we came out of the hospital, the sun had gone down, it was dark. So that was the amount of time it took for the whole process, discharge, the authorization coming from the insurance company for the payment to go through. So it takes anywhere from 2 hours to 4 hours to 6 hours to 8 hours. And looking at the hospital side, the patient, you are worried, okay, you want to go home, but at least you have a bed, you're just sitting there doing nothing. But anyway, for the hospital, that bed is lying useless, man. They may have a patient in waiting, they can't treat that patient because the bed is not available to them. And they can't throw out this patient because the other one. So it's a waste of resources, definitely. Then the kind of information that all these insurance companies are asking, it is going again in a scanned mode, it's a PDF mode. It is not something which we have been talking about, AI, machine, ML, data-driven, things. But then the data is in a scanned form. You can start using OCR thing and you can make it data available to everyone. But then this data is again, OCR, perfection is not 100%. So you can't actually work on this data. The insurance company can't work on this data in a proper way. So again, that is but what we are trying to achieve through health claims exchange, we are trying to do is a protocol-based thing. So data will be sent from hospital. The pre-auth request will be raised in an electronic way. It will go to all the wherever is your insurance is happening, and it will come. So IRDA has recently come out with the guideline that the pre-auth should happen in 1 hour. So it will happen in 1 hour only because if it is electronic. If it is something someone has to make a decision, looking at some document that you have just provided a scanned image, it will not happen in 1 hour. It is the 1 hour is the amount which takes for someone to actually open that. They will have a queue of 50 pre-auth requests, and by the time that 50 pre-auth request has come, if you take 2 minutes, it's 100 minutes. So you have crossed the time of 1 hour. So it can be done electronically. That's what will happen through National Health Claims Exchange. And later on, when you are submitting the claims, the hospital is submitting the claim, so it will happen. All the records which are there, which will go in a standard FHI or what we call bundle format, standard format, it will go, and the hospital will be, the insurance company may use a person, may use any AI-driven systems to approve it. And I think the kind of approvals which come, 60 to 70%, they don't require too much of a doctor sitting there and evaluating everything. It can be automated. So that's what I think we're trying to achieve. And in this process, we have got around 30 insurance companies have actually linked with us. They have done a POC of HCX, and they, as I was saying, when we are doing a POC, we said that we'll have to do it an end-to-end. So we told them to bring one hospital to a workshop in Delhi. We had 3 workshops in Delhi where they actually went through the whole process. First, the HMIs had to be made readily in the system that it can send those information. So we did a workshop for that. Then second workshop was actually the 2 systems talking to each other. So now I think in a few days it will become, it will be made public and everything. So as I said, what we are trying to achieve through ABDM, see, we are trying to integrate everything. But when you say integration, it's not that you have to just integrate. Everyone has to write a program. I want to integrate with RCH. Kaveri has to integrate with 30 insurance companies separately, or any other hospital has to integrate with one system. So it's not like that. What happens currently in the banking system? There's an NPCI switch. You open your ATM, you connect to the NPCI switch. All ATMs are connected. Similarly, there's an SCH for transfer of funds. So similar kind of things what we are having is ABDM. ABDM is a single gateway where every system can talk to any other ABDM enabled system. So that's what we try to say this in between. And yeah, and this is something which is very important for as a patient or a citizen or resident. What I will get out of it, if I say that, I was telling you that I will approve that application, that request on my phone. How will I do it? Will I get a SMS? Will I get thing? So how do you make payments right now? You have Paytms, you have PhonePays, you have GPay. So all those apps are there. These are personal financial apps, as we call them nowadays. So similar kind of thing is a PHR app. So using your PHR app, you'll be able to create your Aadhaar address. You'll be able to link your health record. Suppose I went to a hospital And at that point of time, I did not tell them my ABHA. So they were not able to link my record to an ABHA. But I know I went to Kaveri Hospital, so I will open my app. I'll say I went to Kaveri Hospital. I'll search my records which are available in Kaveri Hospital. I'll get a response and I'll be able to link that record. I can view all the health records which are there in the digital form. They come on my phone. Whenever the record is created, the prescription or any lab test, everything I'll be able to see on my scan and share is an faster OPD registration thing that I can do. I'll be talking about it in the next slide. And as I said, manage consent to share records. When a doctor is requesting for a record, I will be able to approve. I'll also be able to say, out of 10, I said only 9. The doctor may ask for a consent for next 1 year. I say, no, I don't want to give for next 1 year, only 6 months, 1 month, or whatever time I want. And I will be able to update my profile. So these are the various, PHR apps which are available. There's an ABHA app which is a reference app which we have created. Just as for UPI there was a BHIM. I don't know how many of you use BHIM, but still it's there. So ABHA is also there. It's a similar kind of app. It has all the basic functionalities. We are not. There are certain private sector apps. When they say your health records, the lab report, they'll give you a trend and all those things. We are not yet built all those in our ABHA app, but still it is used by many people. And if you want to have that comfort that sometimes my records I don't want to share with a private sector player, you can use this. Arogya Setu, you're all aware of the Arogya Setu app, which was used during the COVID time. So it is not restricted only to getting that certification or when you're traveling, showing that I'm safe on Arogya Setu. This Arogya Setu will be a PHR app. It currently offers for government scheme beneficiaries to download some of their cards related to that schemes also. Then in the private sector, we have multiple apps. Some are very specific to healthcare, which are there, and we also have one Paytm. Paytm is a larger app. They also have a health section on their app, which you'll have to really make an effort to search, but it is there. Yeah. So in the morning, someone was saying that a lot of people go to this public healthcare systems. Yeah, so this is in a public healthcare system, there's a time for registration. There's no value addition in the whole exercise. You just stand in queue to tell that, okay, this is my name, this is thing, and I want to go to a doctor, I have pain in my knee, and that person will tell you, okay, after doing all that entry, he will tell you, go to this doctor. So this takes around 5 to 10 minutes. So if you are, 10 guys, it's 1 hour for you, it's 20, it's 2 hours, and you're just standing there doing. So we talk of queue management system in banks. If you go to private sector, there's a queue management system. You just take a slip and you just stand there, and ultimately, still the time of interaction will be 5 minutes. So what we have done through scan and share, you scan the QR code of the facility, and your details are directly sent to the system, and you get a token number. So when your token number is called, you tell the token number, you tell the problem, we'll just. So it's from 5 minutes, the interaction goes down to 30 seconds. So if you're standing in queue for 50 minutes, 30 seconds into 10, 3-4 minutes, your number will come. So nowadays we have seen in many of the public hospitals, there's no queue. So everyone has a token, but the queue is, the queues have transferred from, OPD to the doctor, but still the non-value added thing is gone away. So you just, so it is in use in all 35 states, 5,900 facilities are using it, and we are doing it around average of 1.8 lakh OPD registrations in the country are happening through scan and share. Yeah, these are some of the numbers. These are statistics. We have around 64 crore ABHAs, around 3 lakh health facilities are already registered. 39 crore records have been linked. So just imagine, these are the kind of records which people can view on their phones, or someone can seek, any doctor can seek. So, and this cuts across many programs. I'll just take you to that side, and 200 plus integrators have already registered. So these are the kind of softwares who have integrated. So it is flowing across government health programs. A lot of us, before I started this in ABDM, I didn't know that government programs have such beautiful systems that they have digital records for many things. We have a very beautiful NCD system which which is doing a scanning for BP and diabetes for a lot of people. They have records of around 30 crore people. They are then scanning. Then we have, Nikshay program, which is there for TB. So the digital records are there for many of these people. But once, suppose some of these people go from these government systems and they go for private treatment, these records are not available to those people. But through ABDM, this will be available, and vice versa. Telemedicine, Sir was saying that's a big thing coming up. E-Sanjeevani is one of the biggest telemedicine platforms of Government of India. It is also ABDM enabled. And I think most interesting part is the private sector players. So we have the, the number one, number two lab players in the market. I think, I don't know number one, but they're still, both of them are already integrated. More are coming in place. We have insurance companies. These logos, we have much more. I don't want to, this for lack of space, and whatever I wanted to pick and put it here. So that's how, all the insurance companies are there with us. Many of the hospitals are there with us. I missed putting the Kaveri logo here, but it's also there, sir. And I was not putting any hospital there, so I think I'll just leave you with this.